So my name is Brian Page. I'm on the orthopedic trauma service. I do orthopedic traumatology and limb reconstruction. I see patients of all types and all ages. Predominantly my patients come through the emergency room or referrals as ambulatory trauma, but I also treat patients with post-traumatic conditions and congenital conditions, particularly of deformity. My approach to patient care is individualized. I like to get to know the patient, and understand their injury and how that relates to their lifestyle, understanding what they do for a living, what their goals are, what sort of extracurriculars they have. Some people, their goals are predominantly around their field of work. Other people, it's about their recreational life. Understanding your patient and what they want helps you decide what the best surgery is. Being that I'm an orthopedic trauma surgeon and limb reconstruction surgeon, I see a very wide breadth of surgical cases. Being at a place like HSS allows me to have the best resources, the most up-to-date implants, and putting all those things together, I can develop a great plan for the patients, present that to them, and hopefully deliver that in the most efficient way possible. Being that I'm dual trained in orthopedic traumatology and limb reconstruction, I try to take the perspective of the reconstructive surgeon into my trauma cases to prevent having to go back and do reconstructive surgeries. Trying to be as accurate as possible with the parameters that I would try to correct as a deformity surgeon allows me to be more accurate as a trauma surgeon. Seeing success in your patients, I think sometimes is a lot like just being a parent. It's like when you see your kid succeed, you're happy. It's like when I see my residents, you're happy, and patients can be the same way. It's, you see someone in my circumstances who comes in through the emergency room, you hardly recognize, and then you see them walk back into clinic and they're dressed and put together, and they're happy. It's priceless.